If you go to Amazon and search my name, Dr. Pawan Mittal, you will find certain books. So the new edition in this book is Geriatric Nursing Care for Family Caregivers. So this book is useful for you as someone if you are serving either in your in-laws or your parents, or you are already elderly. So if you are cross 50, you are counted as elderly. So you should read that book. Don't say that you are not serving your parents. Actually, you are that person to whom that book is designed for. Or if you have elderly parents. So this book is more about the prevention, diagnosis, test for early diagnosis, and if something happens, what should do, including end-stage diseases, including cancer, heart attack, stroke, all those. So the nursing infection prevention, comorbidities, fall prevention, general things what you should do. So for the geriatric nursing care for family caregivers, nursing for family caregivers. It is you either you are a medical professional, doctor or a nurse, or you are a non-healthcare. You will find this useful. Obviously, this book is not for doctors who are strictly managing like a geriatric population. Okay, no. So the target audience is the nurses and non-healthcare professionals for managing geriatric patients at hospital as well as home. So even if you are not a doctor, not a nurse, but if your parents are admitted, what should you do? How to manage? And when they come back, what should you do? So this book is as of now rupees 1900. There is a rupees 1000 cashback. Okay, and that cashback is credited to you within 1 week of delivery of the book. For cashback, you can WhatsApp me your order screenshot. Search my name, and then you will find it. If you need the link, here's the link. Geriatric nursing for family caregivers. It's good. And if you are someone who is like, yeah, parent तो बहुत old हो गए अभी क्या देखना है, या फिर your brother is managing them, or parents are not available, or you don't need to take care of them because they are so fit and fine, they are actually taking care of you, then you can read the other book, Letter to Student, which is more about you and your child. So when you read Letter to Student, it helps you develop your emotional bond between you and your child. So when the child reads and you read, it helps you develop your emotional bond with yourself. It helps you develop your emotional bond with your own parents. So it's not later to the children, it's later to the student. What is today's topic? So we have covered teenagers, we have covered pregnancy, then lactation, then menopause, elderly male. What next? Write in the chat, what do you think should be the logical next? Whatever you think, you write down. There is no wrong answer, there is no right answer. No, all answers are right. Yeah, you write in the chat. So we have also covered children and infants, including adolescents also. Okay, just a second. क्या ठीक है रुको. Have we covered lactose intolerance? Correct. We have covered that. Now the topic next, which I promised last time, was gluten sensitivity and intolerance. Should we do that? Okay. Gluten sensitivity or gluten intolerance. Sensitivity means you cannot tolerate anything. Intolerance means little bit is a problem. Okay. Now you may be able to tolerate, or why I'm saying tolerate like this, we'll come to that. You may have been eating your wheat, gluten for a long time. After some event, a medical event, you realize that you cannot eat gluten any longer. That event made you realize that you are gluten sensitive. You may already be having less symptoms. Those less symptoms were bloating, feeling of discomfort, something is wrong, or feeling depressed. After eating food or gluten, you have been feeling depressed, or diarrhea, or chronic constipation. All those people who have chronic diarrhea, they should be evaluated for bacterial and amoebic infection, parasitic infections, vitamin D deficiency, as well as gluten sensitivity. In addition to lactose intolerance and other allergic things. So for identifying food allergy, what you do? It's very difficult. So all those blood tests, the patch tests, they are not so much reliable, because how many patches you are going to put? So and the patch test is a here. The blood test is in the blood. It's more about IgE, immunoglobulin against that thing. But there is a limited data. Then there are many errors, false negatives, sometimes inconclusive results, lab reports. So the best and the easiest is, though it is a long term, but it is less expensive and it is the best method. You make a list of tentative, whatever is your list, you may not be able to tolerate. Okay, starting from gluten, lactose, brinjal, chilies, chili powder, green chili. So you may write down here 20 things, 30 things, 40 things. All those 40 things you will stop. Eat other things. So for 1 week you are doing it. You are not improved, then you may find whatever you are eating, among that, what is the culprit? Likely culprit. Stop that. 5 things, 2 things. In this process, you may boil down to only 1 or 2 items. It may be aloo chawal, it may be dal chawal, it may be not tur dal, it may be only moong dal chawal, or it may be only chawal and non-veg. Non-veg we are able to tolerate, but vegetarian diet is a problem. Yeah. So you may boil down to 2 3 things which that is acceptable to your system. After 1 week, you are able to tolerate. 8th day, once you tolerate that something, 8th day you add one component. That one thing may be cucumber. So that safer things you add. Right? What is the unsafe thing? Unsafe thing is always brinjal and green chilies, gluten and lactose. These 4 components. So little safer things like green leafy vegetables, cucumber, raw tomato, raw potato, and whatever things you want to add. One by one you add. Now you eat that new atom 2 days. Tolerating? Okay. The third atom you will add. So on you will go. And then one day you will realize there is one atom which you have added. You are not tolerating. You are developing bloating. You are not feeling comfortable. Some discomfort is there. Okay, either in brain or stomach. Yeah, brain discomfort is always there if you are married. That is a separate part. But in the stomach majorly. Or you are having a diarrhea after that. Or you are having gases. You know that. What is that? Sometimes it is about the dal. So the most culprit dal is the Bengal gram, chana dal. Then comes tur dal. Then comes urad. Then moong is the lightest dal. You may tolerate curd, but you may not tolerate milk because milk will have lactose. And in the curd, the process of converting this milk to lactose, milk to curd, the lactose is utilized by Lactobacillus acidophilus, the yeast. Correct? You may be tolerating ghee, butter, cheese because lactose component is minimum there. Now you may be tolerating the pizza, burger, or you may be tolerating the maida roti, but you may not be able to tolerate the frank wheat flour. Okay, you may be tolerating the refined flour sometimes because this gluten is a bigger molecule. So when you strain it to the strainer, this bigger molecule is out, and the maida, the refined flour, will have less gluten actually. I'm not promoting maida. Oi. So the maida is harmful. The refined flour is harmful for your insulin and the pancreas and digestion, all those. That is a separate part. If we talk about the gluten sensitivity, then you may be able to tolerate refined flour. But your chapati, your roti at home, you may not be able to tolerate. So there is no answer that you can eat less. The answer is wrong if you say that I will use mixed flour. No. The answer is you will need to remove wheat. Okay. You may be able to tolerate it little bit, or you may had certain symptoms but you didn't realize, and now certain event has happened, certain medical event or some trauma or some emotional trauma or some crisis has happened that aggravated your autoimmune disease. Correct? That aggravated your gluten intolerance, insensitivity. Have you noticed in cancer and autoimmune diseases, they are there, but some event happens, life crisis, certain trauma, betrayals, right? And then that life crisis aggravates that autoimmune disease. Either it is rheumatoid arthritis, psoriasis, or gluten insensitivity, lactose intolerance, or cancer. Because any of the life crisis, they decrease your immunity. Okay. Do you know there is something called broken heart syndrome? So all those who may not have read this broken heart syndrome, they think that when boyfriend girlfriend, so they don't talk about marriage actually. After marriage there is no broken heart. So it means divorce, okay? But boyfriend girlfriend they live, there is a broken heart. No, my dear, there is no broken heart here. Broken heart is a physical pathophysiological diagnosis. It is visible on 2D echo. So if there is a couple who has been married since 20 years, if one of them had to depart because of certain reason, either divorce or either by death, so the other person, if that other person, if they had a loving bond, that condition must be fulfilled. Then only 20 years is not sufficient. So if there is loving bond, then this other person living survival will have broken heart syndrome. And when you do the 2D scan, 2D echo, you will see the pathophysiological changes in the heart. 50% of these people will die in next 1 year. 80% of these people will die in next 6 months. So have you seen that some people, they lose their both the parents within 6 months or 1 year of time? It's because of this actually. Yeah. So now the question may be whether you should love your partner so much that you are going to die if one partner dies. So that is up to you to decide what you want to do, Baba. Okay. So you should not have so happy marriage. That kills you. Literally kills you. So coming to the point back again. Why you always come to the marriage now, sir? Why? What is the problem? Is everything okay? Bhavya is saying no. No, now in the book also, like, you will find that initial chapters are about marriage and all. Then that immediately all this topic transgresses to mother-in-laws, where especially the pregnancy, the lactation, the children come. Yeah. So whatever your mother says, it is good. Whatever your mother-in-law says, it is not good. What was the topic we were discussing actually? The original topic was autoimmune disease. Okay, very good. I was checking whether you are paying attention. I remember it. So the autoimmune disease comes when there is some crisis in the life. Okay, it may be a spiritual crisis, financial crisis, marriage crisis, job crisis, something else crisis, or a health crisis, some other disease. So that's the time that your glucose intolerance, lactose intolerance, or allergy to the food become evident. You may be someone who are enjoying the food, or you are foodie. So make sure you enjoy your days, because you don't know someday or one day when it will come and suddenly you may have to stop so many food. So if you are foodie, don't wait for your food cravings to satisfy after 40 years. बरखा अभी आज से ही चालू, रोज रेस्टोरेंट जाऊंगी सर, रोज स्विगी ऑर्डर करूंगी. गुड ऐसे ही करना चाहिए. What is the pathophysiology of gluten sensitivity? So gluten is a protein. It's a big, heavy protein. It is found in wheat, barley, rye. So for us, wheat, okay, baba, gehu. And now, whenever you eat this gluten, it interacts with the immune response cells lined up in the intestine. Okay, so how does the intestine? That intestine is big. If you see at microscopic level, there are microvilli. Okay, so the surface is not smooth. The surface is like this. So in this curves, there are a lot of immune cells. Okay. Now when the gluten, if these immune cells are sensitive to gluten, they secrete immunoglobulin E, IgE, which is a classical. So you can measure it also in blood if you have gluten sensitivity, right? And you can measure it certain changes in your intestine also by a biopsy. So traditionally, if you go to gastroenterologist, they will always say, I will do a biopsy to confirm your diagnosis. But I personally prefer, instead of going for invasive method, you can diagnose it by trial and error. Stop gluten, see the benefit, start gluten, and see the suffering. Then again do it one more time. If you do it 2 consecutive times, and obviously you should not be infected with something else that time, right? So it should not be like you take a break of gluten, 1 week you're feeling good, and then you go to a restaurant and then you have a diarrhea. Wrong. because it may be infection, it may be something else, it may be allergy to some food dye, food coloring agents. You don't want that. So you have to continue eating your homemade food, and then you identify that you are gluten sensitive. You do it 2 times, diagnosis is confirmed, almost always confirmed. There is no reversal of this. There is no reversal. Now, why it has happened? Okay, and can you survive without gluten? So the answer is you can survive without gluten, and that survival is better. Have you seen the Asian girls, Asian women, 50 years, 60 years, they look young like 30 years, yeah? No wrinkles, beautiful, and all the thin, lean, and all, right? And they don't look old. And we always say the Mediterranean diet, this diet. Hey, come on, yaar, simple gluten, done. Remove the gluten, eat fibers, eat non-veg. End of story. Non-veg means seafood. I mean, okay, done. Problem solved. Eat less spicy food. End of story. So if you avoid gluten, your aging is reduced. So there are certain benefits. We'll come to it. You may live longer also. Now, what will happen if you are a pathophysiology? We are continuing. So, if you are a gluten sensitive person, okay. So, what this see every time this protein goes to your intestine shows reaction, immune reaction. If you have a mosquito bite, what is going to happen? There is going to be intense reaction, red blood and all those things, okay, and swelling. Plus, this area will look different. If it has repeated mosquito bites, same area, this area will definitely look different than the skin. Same is going to happen at your intestine. So, particular part of your segment of your intestine will become atrophic. Atrophic means the villi size will reduce. It will become flat. If it becomes flat, if it becomes atrophic, it cannot absorb nutrition. It cannot absorb certain components of your food. So you may see directly food being passed in your stools. You may have nutritional deficiencies. Right? Skin is wrinkled, skin is not vibrant, not glowing, hairs are brittle, plus other symptoms are there. Even if you eat nutritional supplement, that will not be sufficient, because the problem is with the absorption here. The problem is not with the availability, not with the food deficiency. It is problem with the absorption. So it doesn't work. So that's why gluten sensitive people, typically you will see they eat anything and anything, but they're always like thin, lean, and they always complain of stomach ache or sometimes laziness or depression after eating food or diarrhea, yeah, and they will be very weak. Obviously, now see, the person is eating more, person has diarrhea, person is thin. What is the other diagnosis? Write down in the chat. What can be the diagnosis? Very good. Write down. Hyperthyroidism. So number one step you will check is TFT, thyroid function test. You want to rule out whether the person has hyperthyroidism. Then you recommend the person to stop certain items from the food, and then come to the diagnosis. Conclusion. How does a gluten sensitivity develop? Okay, so it is an autoimmune disease over the time, repeated, and it will develop. Any autoimmune disease, so you as a nutritionist and dietitian, you should be able to explain to the client how the gluten sensitivity has developed. Normally, this gluten molecule will not cross the intestine. It will not go to the blood. But sometimes there is a break, or the barrier is not sufficient because of certain events, certain things, certain damage to the intestine, either by long-term antibiotic, long-term stress, or some other thing, okay, or some. So this barrier is gone. So gluten will pass into the blood, If it goes into the blood, this is a foreign molecule, this is a foreign protein. So your WBCs will start developing memory for it and start attacking on it. Okay. Now these WBCs are also there in the intestinal lining and they have the memory for the gluten. So whenever they see the gluten, they start secreting certain chemicals. They start autoimmune response. They start having inflammation. And that's how your autoimmune disease to the gluten develops. There has been the association of gluten sensitivity with certain autoimmune diseases, including certain skin diseases or joint diseases and all. Now it's interesting whether if you remove the gluten, will your other diseases will be other autoimmune diseases. You will have benefit. There is no scientific strong evidence for that, but you can try it because the autoimmune response is starting because of the gluten. So someone who has multiple autoimmune diseases including psoriasis, vitiligo, rheumatoid arthritis, certain other things, they should try, including plus diarrhea. So obviously someone who doesn't have gluten problem, they may not be able to say agree if you say don't eat gluten. Okay. But if someone doesn't have gluten intolerance and still become gluten free person, gluten free diet, they have the benefit. That benefit is very much. Gluten free diet is a tough diet. Okay. You will have to sacrifice most of the things you like in your life, starting from the chapati. Gluten has one more problem. It's addictive. Have you ever noticed that you are addicted to your chapati and rotis? Yeah? You eat rice 2 days. You will not feel full. You want your chapati, you want your roti. Yeah? That is addiction. Though that addiction is mild, but it is since childhood. Sometimes the celiac disease there have been association of this. It is called celiac disease also. Gluten sensitivity is associated with type 1 diabetes, thyroiditis, hepatitis, skin conditions, weak bones, iron deficiency anemia. Why iron deficiency anemia? Simple, absorption is weak. Absorption is not happening in that particular area. This may sometimes be get confused with irritable bowel syndrome or inflammatory bowel condition because the symptoms are overlapping and the patient goes undiagnosed. They may also have chronic fatigue, depression and anxiety. Okay. So it is a classical case. The diarrhea after eating, depression and fatigue after eating, not feeling good in stomach and mind, in brain. Most of the these are they go undiagnosed because people are adjusting with that and it is misdiagnosed as irritable bowel syndrome and stress and all those things. So there is one of the student who talked to me a few days back. She is pregnant and she asked her gynecologist, I'm a gluten free person, what should I eat? And the gynecologist was, you can eat everything, because see, the doctors, they have not been sensitized to gluten free diet and they do not understand the importance. Someone who is on gluten free diet and one day you give them half roti, half chapati, they will have serious problem. They will have serious diarrhea for 2 days, 3 days, 18 times, 20 times per day. That's so difficult. Okay. So there are, if you talk about the causes, it can be a genetic predisposition, gut barrier dysfunction, which I talked about. Then infection, stress, and some medicines, long-term NSAIDs and long-term antibiotics. Okay. Diagnostic says my personal favorite is trial and error method, Baba. Okay, but if you must and you want to do, then you can do tissue transglutaminase IgA and endomysial antibodies. This is done after the biopsy. You can also do total serum IgA, IgE, and if you some people do genetic testing, So yeah, you have done genetic testing to confirm that you are gluten sensitive. What next? You have spent 6,000, 10,000 rupees. What next? What after that? Are you going to change your genes? There is no use of doing it. Don't waste your money. Okay. Instead of that, you can come to me and pay my fees. Best is, easiest is, less expensive is trial error. Skin prick and all, they are less reliable, my dear. Okay, always remember. Then there is one more antibody uh, which is found in the blood. You can check for is anti-deaminated gliadin peptide (DGP) antibodies. So, and there is one more which is endomysial antibodies. You can check for that. Typically, if you go to gastroenterologist, they will do everything in this list except the genetic testing. Someone should not be doing genetic testing because it has no benefit out of it. Now, how should you manage? Okay, so the life is very tough. You are gluten free, other family members, they are gluten. The person who is cooking the food, they are not so much sensitive about it, okay, because they do not understand this concept. They are going to put the same hand in the flour and the same contaminated hand in your flour also. The chakla, belan, tawa is going to be same. So first you need to cook your roti, jawar, bajra, whatever you are using, and then cook other rotis. And you have to take care that cross contamination must be avoided. If first wheat flour roti is cooked, you will need to wash your all the utensils, chakla, belan and tawa, hands also. Yeah. And even if you are more than 6 months on gluten free diet, the small contamination also you will not be able to tolerate. Okay. The smell, the flavor of wheat roti is awesome. After 6 months of gluten free diet, you will realize the greatness of wheat flour. You will not be able to tolerate your cravings for eating wheat. But one day you eat, you suffer a lot. So you may not be suffering right now, but if you stop 6 months and just introduce or contaminate your food with gluten, you will suffer a lot. So once you take a decision, that is irreversible. So you cannot go back to gluten diet again. So you may have to shift your diet to regular jawar, bajra, South Indian food, dosa, uttapam, rice. If you eat non-veg, then the life is at least easier. Then you need to help for your gut healing. So for gut healing, there is a chapter of detox recipes. In the detox recipes, there are more than 50 recipes for your gut healing. Okay, including from bale juice, all those apple cider vinegar, bale juice, chawanprash, all those things. Okay, so if you take bale juice, if you take curd, jeera powder, salad, fruits, absolute avoid contamination of gluten, your gut will heal in 1 or 2 years, not in 3 months, not in 2 months. So it's a long journey of healing. And after that, you will have less nutritional deficiencies, provided you are taking sufficient food. Even if you take nutrition supplement, now it will be absorbed. So these people are at prone for vitamin B complex, folic acid, pyridoxine, and vitamin D deficiency, iron deficiency. So they should regularly check for this. In the market, many of the food items you will find that they say suitable for gluten intolerant. Yeah, suitable for gluten intolerant, but it is not gluten free. Yeah. So it will still have gluten. So you have to be careful. Sometimes people think that certain thing is gluten free because they are not read properly and they eat, they suffer. The problem is not only 1 day or 2 days diarrhea or suffering. The problem is your healing, which has happened over 6 months, that healing is again reverts back to a tropic scenario, just with 1 or 2 contamination. So again, you have to restart your healing journey of your intestine. You don't need to buy fancy things. So there are so many exploitation happening in the market: gluten-free chakli, gluten-free atta, gluten-free oats. My dear, oats are inbuilt gluten-free, so you don't need to buy gluten-free oats. So you buy any oats that is gluten-free. Gluten-free bajra, gluten-free jawari. My dear, jawar and bajra is inherently gluten-free. Okay. So ragi, gluten-free. But you cannot eat the ragi flour daily because then it is black color. Making chapat is difficult. So easier is jawar and bajra baba. Ragi you can eat for making your dosa. Yeah. And rice and urad dal dosa is the best dosa actually because it is fermented. So it is always said millets. So now sometimes people start eating millet biscuits. Yeah, but that millet biscuit, if you read the proper content, it shows refined flour to make the stickiness or whatever they want to do to make their dough properly. They have to put it. Then there are some experimental things. I always call it experimental because you can that cannot become your staple food. Kiona, what is this? I don't know how to pronounce it also. Huh? Amaranth. I don't know how to eat it. Okay. Simple, stick to your rice, dal, jawar, bajra. Problem solved. Why you worry so much? If you must add, add ragi. Don't eat ragi biscuits because they are not purely made from ragi. From ragi, you cannot make your roti, pure ragi. How can you make a dough for a cookie then? You cannot. So they are going to add refined flour. So there is a list of items to avoid, there is a list of items to reduce, there is a list of items to substitute. And that's how you should advise to the client. Understand the theory of the client, remove these items, reduce these items, add these items. What will you reduce in gluten sensitive client? What will you reduce? You will reduce certain other food which are known to cause allergies like brinjal, green chili seeds, the thread in the capsicum. You know the white thread in the capsicum which contains capsaicin? It is then lot of spices and all. Because the objective of gluten-free diet is healing of the intestine. You need to educate the client that this is going to be the one irreversible decision. You cannot go back again to eating again. Common nutritional deficiencies these people are going to face. Why? Because number one, some part of intestine is atrophic. They are not able to absorb the nutrition. Number two, many things you have to reduce actually, and that's also causing nutritional deficiencies. Okay. So that you can counter with other items plus nutrition supplement is the best supplement. Whatever supplement you are earning money, you can prescribe to your client. Don't give client protein powder unless you are earning money out of it. So what are the nutrition deficiencies that is going to have happen in this client? So these clients are prone for fatigue, hair fall, paleness of skin because of iron deficiencies. For that you can add green leafy vegetables, amaranth, dates, all those. These people are at a risk of weak bones, cramps, low immunity. So you will add calcium and vitamin D. How do you do that? Milk, vitamin D, arachidone nano. Folate deficiency, they may have repeated mouth ulcers plus anemia. Vitamin B12 deficiency. Have you ever noticed sometimes you have burning sensation in your feet or you have tingling sensation in your feet? That is vitamin B12 deficiency. You think you got exposed to heat or something else? No, it is vitamin B12. So very easy. You take one dose, problem is solved. Bicostos by Pfizer, best. Fiber. So constipation. Now if you have, you know, so the bloating and the gases, if you are less fibers, that also will cause constipation, bloating. If you eat more fibers, you may not have constipation, but you may have bloating also. What should you do? You eat plenty of fibers, you drink plenty of water and take plenty of probiotics. Problem solved. These people are at high risk of frequent infections and slow healing of the wounds. Lung infection, gastric infection, skin infections, or slow healing of the wounds because of zinc deficiency. Whatever you think, gluten-free diet will give you advantage. Either you are gluten sensitive, you are not normal person who is not gluten sensitive. Whatever you think is the benefit of gluten-free diet, write down the chat. Then I will read the list. Inherently, the wheat is difficult to digest as compared to jawar. So why we have staple as a wheat? Because it is easier to make, it is easy to cook and multiple dishes. Plus, jawar has certain nutritional deficiencies of vitamin B complex. So that's why we have selected, our ancestors, they have selected wheat as a staple food. Plus, it is easy to grow. But it is difficult to digest. So that's why you feel heaviness. The wheat diet will also cause you halitosis. You know, sometimes some people are there, even after brushing their teeth, they have the bad breath. So that smell is may not be from their mouth, but from the breath. So alcoholic, that smell for alcoholic is from breath as well as stomach also. Okay, from lungs as well as air also and stomach also. For this wheat eating population, the breath is from the stomach. You try this experiment one time. So you a closed canister, small only, put some wheat seeds, put some water, keep it close. Parallelly you do it with jawar. You will find that the smell in this wheat is much better than jawar. So the bad smell and they are more prone to acne, psoriasis, autoimmune diseases. So what are the benefits if you go on gluten-free diet? Number one, you will have reduced bloating, bowel movement will improve, diarrhea will be reduced, constipation will be reduced, your other autoimmune diseases will improve, including skin and bones. Your nutritional deficiencies will be less. You will have more energy. Surprisingly, gluten-free people, though they eat less, they have more energy, they have more clarity of thoughts. It will reduce inflammation and it supports a lot of metabolism, proper metabolism, and you will feel emotional. Psychology also it affects. You feel more emotional, stable, focus, and sleep quality is better. Why? Because when you are on a gluten-free diet, that supports your microbial flora in the intestine. This microbial flora helps secrete serotonin. This serotonin goes to brain, gets converted to dopamine. Dopamine is a happy hormone. It prevents depression, it reduces anxiety. Less wrinkles on the skin, less aging. You will look younger, your skin will look glowy, brilliant. Yeah? your number of life years will be longer and quality of life will be better. But when you go outside, either for a party or a social event or a relative, then you have to stick to your rice and dal only because they are not going to cook your jawar. Even if they cook your jawar, they will contaminate it. When you go to a restaurant, then you will have to manage with rice and dal. What grains you will avoid? Wheat, barley, rye, semolina, and some more. What grains are safe? Best is rice and jawar. Bajra, some people tolerate, some people do not tolerate. Okay, but if you can tolerate, it's good. Ragi, amaranth, kiona, corn, sabudana. Corn is a good substitute. Okay, corn flour. There is a list of 50 Indian gluten-free foods for lifelong. Okay. You can survive on this 50 list of foods if you decide to go for gluten-free. After hearing, you will not grow older and your skin will be vibrant and less wrinkles and you will look younger, you will live longer. So most of you want to shift to this. You can read that in the book list. Questions? Gluten, vegan, lactose, three separate things. Okay, don't mix vegan in this. I am not a promoter of vegan diet. I am against it. Those are hippies who do not understand that under the name of vegan, they are damaging the ecosystem, environment more, and exploiting more animals, more causing more pollution and eating heavy cost, plus having nutrition deficiencies. There have been certain film stars who went vegan but they had serious nutrition deficiencies. They again became the normal human beings from hippie. Write in the chat if you have any questions related to gluten. Okay. See, normally if you go to a guest, so Bhave is asking how long we should trial and error method before going for other test. If you go to a gastroenterologist, they will do the test first. Trial error is later. But if you are a nutritionist and client comes to you first, then it is always better to go for trial error. But before that, you do thyroid because the symptoms are overlapping, right? So eating more, diarrhea, losing weight, correct? Then trial error is typically 1 week. If you go on free gluten-free diet, you will feel the improvement. Then you try it one day, you have the symptoms, you stop it. And after second week, again try it one day, you have symptoms, stop it. Confirm, almost confirm. Okay. Also remember, if you are on a 3 weeks gluten-free diet, then your lab test will show negative. You understand? So you have to eat gluten before the test. Means you have to eat your normal food. Now Kameshwari is asking a good question. Balanced diet. How do I get my balanced diet while being gluten free? What are you getting from wheat? Can you get that thing from something else? So from wheat you are getting some fibers, you are getting carbohydrate, you are getting certain protein. So all these three things come from jawar. Okay. Certain B complex is missing in jawar, right? That thing you can take care by either your leafy vegetables or certain fruits and vegetables or by nutritional supplement. But remember one thing, if you are gluten sensitive, you are eating gluten, you are eating wheat, you will have more nutritional deficiencies because your absorption capacity is gone. Your intestine is atrophied. Villi are less. So even if you have supplements, nutrition supplement you are taking, you will have nutritional deficiency. So removing wheat from your life will not cause you nutritional deficiencies technically. It will improve actually for a gluten sensitive person. Certain thing, whatever is missing, typically B complex, you can take it from something else. You get better digestion, mental clarity, yeah. You feel happy, more energetic. You have a healthier skin, you look younger, you have less acne, rashes, less autoimmune disease. It reduces overall inflammation. Yeah. You will feel good. It will prevent many infections. How do infections happen? Because you are stressed out, your inflammation is high in the body, so your autoimmune response is less. You are depressed, that time you get infection. So all those things you are taken care by gluten-free diet. I may sound that I promote gluten-free diet even if you are not gluten sensitive, because I have seen the benefits of it. Okay, so after how long gluten-free diet? So absorption will get restored normal. So the absorption restoration takes time, 6 months, 1 year, 2 years. Why? Because the damage is so serious. Plus, you will need some detox recipes to heal your intestine. You will need probiotics, you will need fresh fruits, vegetables, bale juice. Other benefits, you will be able to see actual benefits after 1 year. Skin benefit, your emotion benefit, energy level benefit, all those things. Within 1 month, you will see at least your breath and your digestion and lightness of your body. You try it out 1 week. Some contamination may not happen, it's okay. But at least reduce your intake of gluten. You try it 1 week. So what are the substitute flours? Substitute flours will be jawar, easiest, bajra, rice flour. Don't forget the rice flour. Yeah, many times we eat the rice but we forget the rice flour. Corn flour, then ragi flour, amaranthus flour, chestnut, water chestnut. What is that called? Singara. These are good test flour. You can either mix it, you can eat separate. Oral supplement will get absorbed better once if you are gluten sensitive and you stop gluten for 6 months, it will sufficient. You don't need other forms of administration like IV and all. Very rarely required, not required. Typically, if you are gluten sensitive, you will almost have fatigue or depression feeling after your meal. You will feel bloated. You will feel sometimes pain in your body or headache. Pain in joints or headache. You will feel invariably either diarrhea or constipation. Mostly diarrhea, but constipation also is one of the presentation. So, sir, what should I eat for my thali? What should I eat for balanced food? Simple, everything, dear, everything. Roti, sabji, dal, chawal, salad, pani, sleep, happiness. Probiotics. This roti is going to be something else except wheat. Not a big deal. So, Bhavna is asking if a pregnant person is gluten allergic to complaint, what are the odds of the baby acquiring same allergy as that of the mother? Less likely, not necessarily, maybe. So, that thing you don't need to worry for this baby in the uterus, because once the baby is out, that baby is going to drink milk. Plus, the baby has less autoimmune response to the wheat. So for next 10 years, 12 years, the baby may not show symptoms, or may gradually show symptoms of, after 10 years or 8 years, may gradually show symptom over repeated exposure. Because of repeated exposure, they may show certain symptoms. Fatigue after eating, then joint pains, or diarrhea, or constipation, chronic constipation, or diarrhea after eating. Or they may not show until some event has happened, some major event in life. That is the correct event. Then there is a list of fresh 50 fruits and vegetables to heal your gut, to heal your intestine. Darshana is like, sir, when will you send the book? The day you start sitting in the room with the proper light. Why you had a fight with your husband? You are sitting in the dark. Children is difficult. So you assume, Papa, children, they are not gluten sensitive. Because it is difficult for a child to shift to a gluten-free diet. Okay? You don't need to actually. Unless the child has a lot of sufferings because of gluten. Multiple autoimmune diseases, multiple time diarrheas and all those things. Many of the children, they always sometimes complain after food, they have stomach ache, they have diarrhea. But what can you do? Because shifting a child to gluten-free diet is a tough decision. Okay? And they cannot manage that discipline. That is to be self-imposed. The child will eat from the tiffin of other. The child will eat cookies, biscuit, bread, cake, done. Barkha is like, बच गए ना बाबा, अभी तक ये प्रॉब्लम है नहीं है, जब आएंगे तब देखेंगे बाद में बच्चे सब. So there are certain detox recipes. After this, around 50 detox recipes. How to make those recipes and what are the benefits of it. You can try it for yourself, some of them, whatever is comfortable for you and to your liking, and you will see it. Or recommend to your clients also. Don't take the photo of that detox recipe and put it on your Instagram or YouTube channel. No. If you must put it, then you have to give the link to my book so that they can purchase the book. And I will also give you some money that they have purchased. Okay. If you wish to buy geriatric nursing book, go on Amazon, search my name, Dr. Pawan Mittal, buy geriatric nursing for family caregivers book today, and you will get 1000 cashback within 1 week of the delivery. Okay. Any question? My stamina has gone today. I don't know why. Oh, why I ate bread today morning? So since morning I have been thinking why I'm feeling little depressed and less, energetic and fatigued. So now I realized after the class of gluten sensitivity that I ate bread today. So this is your low energy. Then what is your high energy? Hey, every week you see me here. Then still you ask me now. Questions? Any question, please ask. Otherwise, we end the class. Hey, how's rain in your city? Very good. I was waiting for this. Can soya flour be added? Yes. Okay. So, soybean is a legumes, right? So, legumes are gluten free. All your dals, pulses, legumes, soybean, Bengal gram, chana dal, tuar dal, urad dal, black gram, they are gluten free. Rice is gluten free. Your millets are gluten free. What are millets? Jawar, bajra, ragi, all those things are millets. Okay, but your millet biscuit is not gluten free. Huh? Millet khakra is not gluten free. This khakra, this biscuit has millet plus wheat. They had to add the wheat for the dough. Soya flour. Soybean seeds you can eat. Soya chunks you can eat. You can eat anything and everything, my dear, which does not have heat. So what about cakes? You can try, my dear. Okay. So maybe this cake has refined flour. This refined flour has less gluten or minimal gluten. Plus you are eating one slice. I am assuming you are not eating half kg cake in one sitting, right? So one slice you are eating, so you are able to tolerate. I cannot tolerate that also. I'm extremely gluten sensitive person. So my bread is cooked at home. Jawar is grinded at home. Chakki pisaing jawar at home. Because if you chakki pisaing on chakki jawar, then there is a contamination of wheat from other previous order, right? Plus their chakki. So I'm extremely gluten sensitive person. Okay. Plus lactose intolerant. So what do we eat? Okay. So imagine the life of a person who is sensitive to wheat, तुअर दाल, चना दाल, बेसन मतलब, lactose, then brinjal and all the common is brinjal, green chilies. So what is the food? I will show you the photos actually. The jawar and boiled vegetable with haldi and dhania powder and namak. Nowadays I have started oil also in that. Okay. No pizza, no burger, nothing, no cake. Okay. Short conclusion for gluten-free diet. Arey baba, arey baba. Huh. Good question. So for this question, I have added the one diagram for the conclusion part, Baba. If you have gluten problem, these are the symptoms you will have. If you want to shift from gluten, what are the grains you will shift to? Means wheat substitutes. And how your thali will look like. Okay. So there are three diagrams for it. So for these three diagrams, you will need to wait little bit. सर क्या लिटिल बिट जान चले जाएंगे, एक महीना कर दिया आपने लिटिल बिट करते करते, अभी तक आपका लिटिल बिट खत्म नहीं हुआ. Actually, my dear, the new edition I'm still writing. This new edition is this weight is worth. I guarantee you. Okay, personal guarantee. This weight is really worth. You will love this new edition. I made a lot of changes, new additions. You will WhatsApp me, sir. I love you. You have written the best book. Means modified that. Okay. So book was already the best, but I have now got into the OCD of the book, so I want to modify it. But in between, then I have ADHD also, so I shifted to writing two books in the middle. One was medical legal safeguards, and one was geriatric nursing. Medical legal safeguard, I wrote it 3 times. It took me 6 months to write the first time. Then my file got erased or deleted here during troubleshooting of MacBook. And then I wrote it. Then half part got deleted again. Then I went complete crazy. 7 days I did not sleep, did not brush my teeth, mouth also. And I used to bathe, yes. But 7 days I did not sleep and I wrote third time, Medical Legal Safeguards. Now it is one of the top selling book in that segment. It's available on Amazon, you can buy it. If you want to buy it, you can WhatsApp me, I will give you 80% discount. Okay? 80% cashback, discount, whatever you want. Upfront discount or cashback, I can do anything. And now the geriatric. So that day I had this crazy thought, I should write geriatric nursing book. Will it sell it? No. Is there a demand? No. Only less demand. Do you want to write it? Yes. So I woke up in the night, start writing, completed till morning. It's also good, huh? You will love it. So I have kept a low cost for geriatric nursing. So today you go to Amazon right now after this class, okay, before you fight with your husband, and then search my name and Dr. Pawan Mittal. Find all the books, my name. Whichever book you like, use your husband's credit card to buy it. Problem solved. Am I back again? Are we connected? Okay. So I was saying that, so search my name on Amazon. Whichever book is your liking, buy it using your husband's credit card. So that was the reason that before you fight with your husband, visit Amazon. Okay. Have a great time. See you then. See, light has also gone. So this electricity department, they want to end the class. That's why. Otherwise, I would have continued it beyond 5. I have a lot of stamina and energy because I'm gluten free, lactose free, regular probiotics, Actico Pro, lot of vegetables, fruits, then no Bengal gram, difficult to digest. Okay, no outside food, right? Yeah, but married now, so that's why sometimes depression is there, always there. Okay, have a great time. Bye. Barka like, sir, why do you come to that every time? You will realize once you're married, dear. Only people are not talking. Okay? Yeah, everyone suffers through that. I'm alone in my room, so I can talk freely. Huh? Okay. Bye. Have a great time.